Good afternoon to the Board of Directors and CEO of Health Services. Thank you for this unique opportunity to discuss the health and well-being of Aboriginal and Torres Strait Islander people. My name is Abigail Tengillig and I'll be discussing the topic of holistic care.
My name is Naomi James and I'll be discussing Aboriginal and Torres Strait Islander community control health services.
I'm Amelia Burke and I'll be discussing interdisciplinary collaboration.
I'm Jyoti Vagahal and I will be discussing intersectionality today.
I'm Yuki Jo and I'm going to talk about discharge against medical advice.
It is therefore fundamental that we incorporate and recognise these concepts in health services today to ensure that we continue the journey of reconciliation through cultural safety to reduce the health inequalities that Indigenous population face today. There is a wide gap in health status between Aboriginal and non-Aboriginal Australians. The problem that the mainstream health system has today is that when Aboriginal and Torres Strait Islanders are sick, their health is not improved effectively. Mainstream health systems focus on the biomedical needs, but to improve the health of Aboriginal and Torres Strait Islanders, their holistic needs need to be addressed. Providing holistic care is vital for Aboriginal and Torres Strait Islander because health to them is viewed in a holistic context. As defined by the National Aboriginal Community Controlled Health Organisation, Aboriginal health refers to the well-being of an individual as a whole: physical, social, emotional, and cultural well-being. Environmental factors, socioeconomic factors, community capacity, health behaviours, and person-related factors are determinants of health. These are barriers and affect the health of people and influences how a person interacts with health and other services. This is reflected in the statistics presented in the Aboriginal and Torres Strait Islander 2017 report. The report shows that concerns and interaction with accessing the health systems of Australia. In 2012 to 2013, 21% of Indigenous Australians reported to have problems accessing dentists, 14% doctors, 9% other health professionals, and 6% hospitals. These reports show that Aboriginal and Torres Strait Islanders are not responding to the mainstream health system in providing their health. The mainstream health system is to meet the needs of all individuals regardless of who they are. This is health equity. Cultural differences play a huge part in this. According to the Aboriginal Social Justice Commissioner, Tom Calma, the inequality in health status that they continue to experience can be linked to systematic discrimination. This is a huge barrier for the mainstream health system because it negatively affects the procedures and interventions experienced by Aboriginal and Torres Strait Islanders. Discriminating cultural differences in values and beliefs cause a barrier in communicating and providing cultural safe practices. In providing holistic care, these beliefs and values cannot be ignored. Overt and systematic factors of racism would also cause cultural unsafe care. Health inequity, seen through determinants of health, are barriers in preventing the mainstream health system to provide holistic care to Aboriginal and Torres Strait Islander people, and mainstream health systems to provide the care to Aboriginal and Torres Strait people. This is then affected in providing cultural safe practices. Therefore, cultural barriers are formed and prevent the mainstream health system to effectively meet the health needs. In conclusion, as discussed in this report, these barriers, which is preventing the mainstream health system to meet the holistic needs of Aboriginal and Torres Strait Islander people. These barriers cannot be ignored and need to be taken into consideration when implementing healthcare policy planning and practice for holistic care to occur in Aboriginal and Torres Strait Islander people. I will now introduce Naomi, who will discuss the topic about Aboriginal community controlled health services.
Thank you, Abby. Alright, I'll talk about ACCH, Aboriginal Community Control Health Services. ACCHS is an incorporated Indigenous organization that provides primary health care services that are initiated and operated by the local Aboriginal and Torres Strait Islander people to deliver a comprehensive, holistic, and culturally safe care to the community which controls it through a locally elected board of management. ACCHS have holistic views of the Aboriginal and Torres Strait Islander healthcare needs due to cultural barriers that are not addressed by the mainstream health services. ACCHS was established based on the principle of self-determination, and accordingly ACCH approach to health incorporates body, mind, soul, land, environment, and the socio-economic status in accordance with the Aboriginal and Torres Strait Islanders' definition of health. The first ACCHS was established in 1971 in Redfern, an inner city suburb in New South Wales, by communist activists against the ongoing discrimination of Aboriginal and Torres Strait Islander people within the mainstream health services to address the health disparity amongst them. It is now expanded to a versatile healthcare facility that provides free medical services, dental, substance abuse, and psychology counseling services to the large Aboriginal community in Redfern. There are now over 150 ACCH services across Australia. In the recent AIHW report about ACCH service, it reported that there are about 3 million episodes of care each year for about 350 people who access ACCH health services. In the remote areas, the service provided about 1 million episodes of care back in 2015 and 2016. Moreover, individual ACCHs is based on the local community needs and the priorities. For example, in some cases, poor nutrition or substance abuse is addressed, whilst in other cases, programs are directed to specific special needs such as pregnant and breastfeeding mothers or the elderly. In conclusion, ACCHs are also active in the area of advocacy. This involves providing a voice for the community so that their need can be expressed. Although each ACCHs operates independently, they form a national network within their collaborative interest, represented both on state and territory levels and also nationality. I will now hand it over to Millie, who will talk about interdisciplinary collaboration.
Interdisciplinary collaboration is a vital component when considering the health and well-being of the Indigenous population. Health professionals and nurses play a significant role in the care Aboriginal and Torres Strait Islanders receive over their lifespan. However, barriers are frequently confronted due to the complexity of related historical, political, cultural and social issues. It is therefore important to recognise and acknowledge how these associated factors impede the delivery of care provided. This is necessary to encourage a journey of cultural safety and reshape healthcare services through initiatives like interdisciplinary collaboration. Interdisciplinary collaboration refers to a concept whereby health professionals work cohesively in a team environment to provide optimal nursing care, enhancing patient outcomes and meeting individualistic goals. Interdisciplinary collaboration aligns with the 9th Nursing Competency Standard, Collaborative and Therapeutic Practice, highlighting professional boundaries of trust, respect and dignity, building rapport, effective communication, shared decision-making, and physical, cultural, spiritual and psychological security. A change in policy from assimilation and integration to self-determination and self-management saw the emergence of Aboriginal and Torres Strait Islander health workers. Today, their role is integral to providing continual support and working towards closing the gap, which is essential to establishing a cohesive and dynamic interdisciplinary team. Indigenous health workers possess numerous strengths that benefit and enable the healthcare team. Firstly, the care Aboriginal and Torres Strait Islander healthcare workers provide is responsive to the needs of the Indigenous population and surpasses traditional models of care. Aboriginal and Torres Strait Islander health workers furthermore support the education of non-Indigenous health professionals, ensuring cultural awareness is established. Indigenous health workers are commonly confronted with barriers that impede their practice and create tension among health professionals. Factors such as white privilege and power dynamics are to be acknowledged by non-Indigenous health workers. Finally, knowledge of Aboriginal and Torres Strait Islanders' scope of practice must be clarified and promoted within the health setting so members of the team can support the development of Indigenous workers' clinical skills and tasks can be delegated more efficiently. Therefore, through the discussion provided, it can be attained that the role of Aboriginal and Torres Strait Islander health workers is fundamental in supporting the provision of care for the Indigenous population through interdisciplinary collaboration. I will now hand over to Prativa. Thank you.
Thank you, Amelia. Today I'm talking about intersectionality. Intersectionality in general is a concept which says that oppressive social structure like race, gender, ethnicity, sexual orientation and class are interconnected with each other and cannot be seen separately. LGBTI people have already various issues like stigma, discrimination and inequality. When they belong to Aboriginal and Torres Strait Islander community, they have experienced double disadvantage. Brother boys or sister girls face problems in areas like health, education, violence and alcohol and drug use. This is remarkable problems related to mental health like suicidal ideation and depression in Indigenous LGBTI people. They are often secluded and isolated from the community, which further increase their mental health problems. Social problems like racism and transphobia are repeatedly faced by Indigenous transgender Australians, which further increases their high alcohol consumption and use of drugs. Other significant health problems that Indigenous transgender Australians go through are HIV/AIDS, physical and sexual abuse. It has been found that there is not much education about HIV/AIDS and other sexually transmitted diseases in LGBTI people, which further puts them at higher risk. Various organizations have been working towards improving LGBTI health and providing them with suitable services. One of them is ACON, which provides counseling and other community care services for Aboriginal and Torres Strait Islander people with HIV. National LGBTI Health Alliance runs mental health and suicide prevention project named Mind Out. Mind Out team works with Aboriginal and Torres Strait Islander people within LGBTI community to identify and respond to their mental health needs. Another program called Two Spirits is developed to improve sexual health of brother boys and sister girls. This program's main focus is to promote community awareness of Aboriginal and Torres Strait Islander LGBTI sexual health. Black Rainbow is another platform which is Indigenous LGBTI suicide prevention national advocacy platform. In conclusion, LGBTI people in Aboriginal and Torres Strait Islander community have various health issues which are further worsened by level of discrimination and isolation that they face. Healthcare provided to them must be free from stereotyping and should be culturally safe and respectful of their gender identity. Various health services are nowadays available which help them with their health problems and easily accessible. I would now like to introduce Yuki.
Yeah, thank you.
Good afternoon, directors and officers. I'm Yuki, and I'm going to talk about discharge against medical advice among Aboriginal and Torres Strait Islander in Australia. Why discharge against medical advice from hospital is relatively rare, they are overrepresented in Australia patients and some diagnoses. And when it happens, it is associated with some adverse health outcomes and are considered an indicator of the responsiveness of hospital to the needs of Aboriginal and Torres Strait Islander people in Australia. Discharge against medical advice, also referred as self-discharge, occurs when the inpatient leaves a hospital or healthcare settings before discharge is advised by the treating provider. Discharge against medical advice causes interruption of the treatment therapies and is strongly associated with post-operative complications, increased mobility and mortality, and readmission. The consequences of discharge against medical advice is serious. For example, high cardiovascular morbidity and mortality rates in Australian people contributes 33% of the Aboriginal health gap. And improving healthy outcomes of Aboriginal cardiac patients is priority for patient sector, and high quality hospital care is necessary to Aboriginal and Torres Strait Islander people. None of this could be achieved if the rates of discharge against medical advice occurring in this rate. Discharge against medical advice is associated with both patient and hospital factors. In this presentation, I'm going to talk about the health system factors contributing in the rate of discharge against medical advice. There are institutional racism, a lack of cultural safety, a distrust of the healthy system, miscommunication in health system, family and social obligations, and isolation of loneliness in the hospital and healthy settings. They are presented as medical staff lacking appropriate cultural training, Aboriginal and Torres Strait Islander patients feeling unwelcome and misunderstood. They are suffering from anxiety and anger and negative associated with the hospital. However, there's one health system improvement strategy we could use in daily practice to reduce the incidence of Aboriginal and Torres Strait Islander rates of discharge against medical advice. That's enhancing cultural safe in clinical practice. From RIGHT in 2009, cultural safety is based on partnership between provider and patient, in which shared respect underpins improved communication, treatment decisions, and health outcomes. And from the theory of Williams from New Zealand, in clinical practice, we should provide an environment which is safe to people, where there is no assault, challenge, or deny of their identity, of who they are, and what they need. It is about shared respect, share meaning, share knowledge and experiences of learning, living and working together with dignity and truly listening. More specifically, in Australia now, the presence of Aboriginal health workers and Aboriginal liaison officers, referred as AHWs and ALOs, has been demonstrated to enhance cultural safety, improving patient care, and in certain cases, significantly reduce self-discharge. So they are occurring in each hospital and working as hospital members to help Aboriginal peoples improving their health care. This is my topic about discharge against medical advice. Thank you for listening.
Thank you for your time today. We hope that you take into consideration these fundamental aspects to diminish health inequalities and improve the provision of care for Aboriginal and Torres Strait Islander people. Thank you.
Thank you.
Thank you.